Okay. All right. So as I have introduced myself, I am Dr. David Kalema from Hope and Beyond, a rehabilitation center found in Kampala. I would like to present on management of addiction in the context of a counseling world. So I will base so much on the counseling part, on the therapeutic way of managing addiction, whereas the previous presenter gave so many examples from the medical part. That is just a view of our Hope and Beyond. That is how it looks like. That is the view from a distance. It's a rehabilitation center, as I told you, and we have about 18 residential patients. We also do research, and we also do prevention, advocacy, outreaches. I'd like to say that addiction counseling is a complex and yet largely a virgin subject, especially in developing countries. In Europe and USA, they have made a lot of advances in research when it comes to addiction counseling. But for us who are considered to be coming from developing countries, it's a whole way to go. A lot of research we cite from the Europeans or the Americans, and it's really an opportunity for us to invest our energies to do more research and understand more about the problems of our people. Addiction is a repeated behavior or use of substance resulting in failure to fulfill major roles or obligations at work, school, or home. That was well elaborated by the previous speaker. Today, though, we want so much to move from the word addiction to the word disorder, because terms like addiction, substance abuse are associated with stigma. So, I want to use our problem in a way that will not make our clients feel uncomfortable. So we use so much the term use disorder. I'll quickly give you maybe as a recap of what the previous speaker said. How do we diagnose use disorder using DSM-4, 5? We have what we call social impairment, where a person fails to fulfill their social obligations. We have what we call impaired control, where they fail to use control over their alcohol use. And under impaired control, we see that a person progressively getting preoccupied by the substance they use. As you can see in the first picture, the person is beginning to use the substance in red, but they have time for other activities. In the second picture, the substance is up on the time for their sports, for family, for work, for food. And the third picture, which is intensified regular habitual use, it's further, almost 3/4 of this person's lifestyle. Whereas when a person reaches what we call a severe alcohol use disorder, or what is known as addiction or dependency, the person is completely preoccupied by the substance. The other signs and symptoms of addiction is risky use, that is use that associates with the damage caused on human, on their physical health. And then we have the pharmacological criteria where we have tolerance. A person needs to use more to get to the same effect, and also withdrawals. If someone has at least 2 of those features occurring in a period of 12 months, then we conclude that that person has an addictive or an use disorder. Hello? Hello? Hello?
Hello, you are audible, sir.
All right, so I can continue. I would like to talk about 7 important elements of counseling people with use disorder. So let me limit it. Let me use the example of alcohol use disorder. But these elements are also important if you are counseling a person with any other use disorder. It can be gambling, it can be food, eating disorder, it can be other drugs. So these clinical elements are universal. One, it's important for a counselor to observe, to work on their characteristics and style. It's important for someone to pay attention to the helping relationship. It's important for someone to have basic and core counseling skills. Some people have the mistake of coming out of a rehabilitation center as clients, and they feel that because they are in recovery, then they can be addiction counselors. No, it's very important for someone to get core counseling skills. Individual counseling is very important. Someone has to be aware of the stages of change and the strategies of change. These are 2 important concepts. I will elaborate on them later. Management of group counseling is essential. Involvement of family is essential, and teaching clients skills. Let me go a little bit in details on the first one, which is the counselor characteristics and style. That slide shows what we understand by counseling, which is a process of empowerment to facilitate, to teach, and to support. Counseling is a relationship between the client and the counselor working towards a goal. So what do we mean when we talk about counselor characteristics and style? If you like to help a person with an alcohol use disorder, you have to reflect, first of all, on how you can make a difference in this person's life. Maybe I can pause now and ask people who are following us to think about a person who made a difference in their lives. It could be a parent, it could be a spouse, it could be a friend, it could be a teacher. What characteristics did that person have? So it is those characteristics that you need as a counselor, that I need as a counselor, if I am to help someone with an alcohol or a substance use disorder. Research shows that clients with the best treatment outcomes have counselors with the best interpersonal skills, have counselors that use confrontation least. We are not saying you don't use confrontation, but you use it more or less a few times and more or less as a last resort. And counselors that are most empathetic. 2, the desirable interpersonal skills include competency. I have to be competent. I have to study. I cannot gamble when I'm doing this work. I have to be genuine. There has to be immediacy. Sometimes the client needs your attention there and then. A counselor needs to be warm and have positive regard and respect for the client. Then there is the concept of counselor intentionality. That is, when selecting helping behaviors and specific strategies with a clear purpose and direction in mind, a person who is helping someone with alcohol or substance use disorder must have in mind, where do they want to take them? Do they want to take them to abstinence? Do they want to take them to moderate or reduction in drinking units? That has to be very clear. And my question to you, who is listening to me now, what strength do you bring to your work as a counselor or as a therapist? And also, of those 4 that I have identified, you need to ask what areas you need to work on so that you can be more effective. I'll go to the point of helping relationship. The relationship between a counselor and a client, and the means by which the professional hopes to empower the client, engage with the client, support the client, and support change, facilitate change in the client. That's very, very important. A counselor or a therapist needs to have boundaries, to set limits on the behaviors. Maybe there are some cultural issues between, but there has to be clear boundaries so that we do not end up in dual relationships. Is your client at the same time is your lawyer? Is your client at the same time is your banker? Those dual relationships are really discouraged. And then clarify expectations. Then self-disclosure. A good therapist needs to know how much they need to tell their client, knowing very well that when you disclose too much, it might work against you. Avoiding managing dual relationships. Awareness and management of transparency and counter-transparency. These clients, when they come to us, sometimes they will get what we call transparency. They will see us image of their loved ones. Maybe they will see us in the image of a pastor. Maybe they will see you in the image of a son. Maybe they will see you in the image of a mother. And they may start behaving to you as if they are behaving to their mother, behaving with you as if they are behaving with their wife. So the ineffective person in a helping relationship has to observe that now this client is going beyond relating with me as a client. It's coming something else. But you also have to be aware of yourself, what we call counter-transparency. Because you may also see this client as your son, as your brother. Once a counselor starts seeing that, then they know that they have to work on themselves, because transparency and counter-transparency normally affects a relationship, a therapeutic relationship. Then a counselor has to understand the verbal and non-verbal cues. Application of core counseling skills, such as reflective listening. Counselors listen. Sometimes these people come to us with a problem, and all we need to do is to listen. But listening is a skill. That's why we can even have different types of skill listening. We have simple, amplified, reflexive listening. Any therapist has always to be on guard to listen, to ask open-ended questions centered on a client's concern and not judgmental, to affirm when a client makes a step, even if it's a simple step, even if it's a small step, every day they spend without drinking is worth affirmation. And then summarizing what this client is saying, and then dealing with the resistance. Studies show that 90% of people with alcohol or drug use disorders also have resistance. Denial is very high. So you have to have strategies of rolling with resistance. Next is becoming aware of the individual counseling, individual awareness of stages and strategies of change. I am sure most of the therapists know these stages of change: pre-contemplation, contemplation, preparation, action, maintenance. An effective counselor needs to know the stage of change of their client and where they want to take them. Next is individual counseling, awareness of stages. Now, most people are aware of the stages of change, but rarely utilize the strategies for motivation for treatment. So a counselor needs to have an insight on the strength and weak areas in terms of internal and external motivation and work with those. For example, under internal motivation, a client has to acknowledge their problem, they have to have desire to change, and they have to be ready for treatment. There are standardized tools that a counselor should take a client to give a client a test to see at what level of internal motivation they are. If a client has not even recognized their problem, you cannot give them therapy that helps them to be ready for treatment. Also, you have to be aware of the client's treatment needs and the pressures for them to be in treatment. And those are called external motivation. And a therapist has to work with all those aspects to see that our client is well catered for. Then we have management of group counseling. This is an important skill in helping people with alcohol and drug use disorders, because we know that many of them also have been taking alcohol in a group, so they need this group energy to help each other, to synergize each other. Someone has to have a good understanding of how is a group managed, because group counseling is not the same as individual counseling in a group setting. The two are different. Using individual counseling skills in a group may not always be effective. There is need of a group as a whole. This must be balanced with the needs of the individuals in the group. Group counseling includes group facilitation skills that enable the group to do most of the work and manage disruptions and manage group conflicts and groups. Then, second last is psycho-education groups for clients and families. Families are a very important component of recovery. There is no way it will be very difficult for us to achieve lasting recovery of our clients without involving families. So a counselor must start learning psycho-educational group settings and educate their clients about substance abuse and related behaviors and consequences. This type of group presents structured group-specific content, often taught using videotapes, audio, or lectures. Frequently, an experienced group leader would facilitate discussions of the material. It's very important for the awareness of different subgroups. You can have a recovery group, a family group, a skills group, and different needs and they have different needs and management style. Finally, while managing clients who are being treated for alcohol or substance use disorder, we have to be very important. I mean, we have to be very we have to be we have to emphasize teaching client skills. These client skills can be categorized into three broadly. For example, refusal skills. Many of our clients do not have refusal skills. They don't know how to say no. They don't know how to say no to alcohol or drugs. That's why they are using them. They don't know how to say no to their peers. They don't know how to say no to too much work. That's why they become workaholics. That's why they get burned out. So we have to teach them refusal skills. We have to teach them time management skills, thought stopping techniques, and problems solving techniques. We need to have principles, individualized, client-based, and client-centered. What do I mean? That when you have so many clients in a group, it does not mean that you only work with them in a group. You also have to work with them one-on-one, so that you individualize the clients, because every client is special. Every client has special. They may have very similar psychiatric or treatment program, but when it comes to the psychological program, every client has their own needs, pace, and so we also have to be client-centered. And finally, guidelines. It's important to be practical, not just to give them lectures like I'm doing now. They learn more by doing. It's important to repeat things to them because their brains have been so much affected by the substance and they may not pick things very fast. So don't be scared, don't be worried, don't fear to keep repeating certain things that you feel are important. And to solicit their commitment. Once you see that they are convicted, don't hesitate to ask them to commit themselves. Maybe to spend one day without drinking. You can, I normally tell my clients, when I'm discharging them, before you drink, I want you to give me a call. Whenever you feel like you are craving, give me a call or talk to my counselor. And then if that is not going to help you, then you can go ahead and drink. By doing that, once they commit to that, when they call me, by the time they finish the conversation, the urge has gone down and they feel that they have been supported. Then anticipate obstacles. Many times when clients come in treatment, they leave thinking that they can do anything. But it's important for us to prepare these clients and let them know that life is going to be even more difficult. So they have to always anticipate obstacles and know how to deal with them. And finally, to explore resistance. Any addiction counselor needs to know that resistance is a characteristic of resistance and denial is a characteristic of addiction. So when your client is in resistance, you should not feel frustrated. Just be aware that it's a characteristic and find ways of rolling with that resistance. That is my address, just in case you may have further questions or you would like us to discuss certain things beyond here. I welcome you to contact me on that address. And this is just an overview of our center that we are planning. We are planning to build an addiction center of excellence in the heart of Africa. And as you can see, we want to be so homely and so comfortable and so nourishing with with as many aspects as possible, both medical, psychological, and those that are for livelihood. That's our vision. And with that, I want to thank you. That young man there is saying Kajambo. Kajambo is saying hello there. And thank you very much for giving me this opportunity.